New technology is promising to make fighting cavities easier. It's called fluorescence visualization, which is similar to Doppler radar, and it's now taking the guesswork out of identifying tooth decay.
That blast of air dries the surface of Nicole Blakeney's teeth, making them camera ready.
The camera that we have today will actually just send a light beam into your tooth. There's no radiation involved. And as the light that comes back, it will tell me if there's bacteria within your tooth or not.
San Ramon dentist Kachalia is using a device called Spectra to capture these high-tech images of Nicole's teeth, mapping potential trouble spots. Bacteria will fluoresce at a certain wavelength.
The purplish blue that you see about the middle of the tooth tells us there's some early breakdown to your enamel.
And at this stage, it's reversible with better brushing, perhaps adding fluoride to that area. But spots that are reddish-orange indicate decay.
The red highlights that you see tells us that you've broken through the enamel and you're starting to get into the barely into the second layer tooth structure.
His recommendation, a small, conservative filling.
I think dentistry has changed more in the last 5 years than almost the prior 50 years.
As an associate professor at UOP's Dugani School of Dentistry in San Francisco, Dr. Kachalia is in charge of implementing new dental technologies there.
It doesn't replace our mindset or our brains and our general look. What it does, I think, is an additive factor.
Personally, I love it because it's a lot less intrusive than using a little fork to poke at your teeth.
Instead of poking for sticky spots that could indicate decay, the camera captures detailed images that become part of a patient's electronic medical record.
With a picture, we can see the image, have it present today, and then do follow-up and compare the two. We can overlap the two images and decide, has there been any growth in the lesion or the decay area that's present, or has it gotten better?
And patients like Nicole become part of the process.
We're all visual people, so I mean, if you can look there and see visually, here's the red, you know where you need to be working.
Now, the technology recently received FDA approval. Dr. Kachalia says it doesn't cost his patients anything extra. It's an investment he's made in his practice.
Dental Doppler, all right. Well, coming